Before I introduce our speakers, I just want to briefly say why we're holding this event. Since the government announced the vaccination programme, we at Healthwatch Greenwich have received many questions, queries and concerns, both about how the vaccine's been developed and safety concerns. And we've also received questions and queries about how the vaccine's being delivered in Greenwich. So the format of today is a short presentation and questions, hopefully from you, the audience, and then we'll go to questions that have been sent to us in advance. But again, as I say, if you've got any further questions, do type them in the chat box. After our first presentation, we are then going to hand over to our other speakers for some more specific questions on the implications of the vaccine for those with existing health conditions and more specific queries and questions. So just to introduce our speakers, and I'm going to ask them to give you a wave, so you can hopefully see them on your screen. So we have 4 speakers today. We've got Councillor Linda Perks, Councillor for Charlton. So Linda, if you can give us a wave. Lovely. Hopefully people can see. Can people see Linda? Keep waving, Linda, keep waving. Lovely. And then we have Jackie Davidson, Assistant Director of Public Health for the Royal Borough of Greenwich. Jackie, can you give us a wave? Mind you, we're over 3 screens here, so it might be difficult for people to see you, but keep waving, Jackie, keep waving. Thank you. We have Dr. Saba Salman, a local GP and governing body member at South East London Clinical Commissioning Group. Saba, can you give us a wave? Oh yeah, I can see you, Saba, I can see you, hopefully others can see you. And we also have Dr. Krishna Subbarayan, a local GP and the clinical lead for South East London Clinical Commissioning Group. Krishna, can you give us a wave? Thank you. Like your jumper, like the green jumper, Krishna. Okay. I am now going to hand over to Jackie Davidson, Assistant Director of Public Health for the Royal Borough of Greenwich, and she's got a short presentation that hopefully will answer a number of the queries that we've had about essentially, you know, how the vaccine was developed, you know, how viruses work, and also some information about the safety of the vaccine and actually what's in the vaccine, as well as she'll give us some information about the priority groups that will be getting the vaccination. So I will hand over to Jackie.
Lovely. I've just tried to share my screen. I'll need to be enabled so that I can do so, Anastasia. So if you can do that, if not, you might have to share the screen for me.
Sorry for that, Jackie. Can you please try to share again?
Let's try that. Excellent. Thank you. Perfect. So has that come up? Can people see this now? Lovely. Okay. So what we wanted to do is we thought we would try and cover some of the science of the vaccination program, because actually some of the science allows us to answer some of the questions that many people are raising. So what the presentation is going to be short. Hopefully we'll cover some of the questions, but I think the most important bit is that free flow of answering the questions that you specifically have. But if I just take a few moments to cover some of the science. So the first bit about the science is about what is the virus, what is a virus, and how does it work? And actually viruses are non-living parasites. And what they actually have is they contain a bit of genetic information. That could be DNA, it could be RNA, and that's surrounded by a protein coat. And that on its own can't do anything. What it has to do is find a host. And that host is generally us, and it's our cells. So what a virus does is it goes into our cell once it comes through so in the case of COVID, it's inhaled, goes into our respiratory tract, and then it enters the cell. And so you can see in the diagram, the virus enters the cell, and then what it does is it injects that bit of DNA or RNA into that cell. And what that does is it then takes over our cell, and it tells our cells to manufacture the actual virus and the shell. So it starts replicating. Those are then pushed out and then multiplied, and then those are what then eventually takes over our body and causes us a lot of harm. So that's how a virus works. So normally we have a really good body and we have lots of mechanisms that pushes that virus away. So some of them can be simple things like skin protects us and some natural barriers, but also we have something called the immune response. So what happens is when that virus goes in the body recognizes that it's an invasion, and it will react to that. And it reacts in a couple of ways. So it reacts by something called B cells, and they produce the antibodies and they attack the virus. It also produces something called T cells that helps the antibodies and the B cells, but also what it does, they're called memory cells. And what they do is they stay in our body if we've been infected, and they remember that virus, and they respond subsequently in infections. So clearly that's how the immune responds. But and some people have naturally, as we know, they naturally fight a disease, but others, they don't have enough immune response to do that and therefore get sick. So when you think of the vaccine and how it works, all the vaccine does is it stimulates your immune response in the natural way that your body would do it anyway. But it does that, and it does that by putting a harmless form of the virus inside you, and that activates just what we've described. And it's as simple as that. And we all know that we have vaccines have been used from MMR and all of the other vaccines that have been used in the past and are well tried and tested. So in the case of this, there are different ways. So there's a number of vaccines on the market, and mostly you'll have heard about is something called Oxford AstraZeneca, and the other one that you'll have heard of is Pfizer. They work in slightly different ways. And I won't go into the detail here, but anybody who likes more of the science, when we send out the presentation, I put a link in, and it's a very straightforward link, and it tells you exactly how they work in different ways. But the first things to say is vaccines don't change your DNA at all. And I think because the virus has a bit of DNA, I think there's a lot of misinformation about that. They do not change your DNA. You do need 2 doses of the vaccine to be most effective. And this has caused a little bit of contention, because we know that the program, a lot of the Pfizer vaccine, we had to deliver 3 weeks later, and then it was changed to 12 weeks. And why is that the case? So what happens is once you have your first vaccine, you will get a good immune response, just as I've described before. What happens when you get a second is you get an additional boost to that. But after the first vaccine, in terms of the Pfizer, it's already about 89% effective. And with the second dose, you might get it up to 95%. And in the case of AstraZeneca, it's already about 73%, and you can get that up to 90% or so. So what they realized is, in terms of why they changed that timescale, is it was better, and we are more likely to save more lives if we vaccinate more of the population once than a smaller or half the population twice. And that's why they did it. But that's fine. You will still get your booster, and you will get it within a good time period to make it effective. So a couple of other things people have asked is you can't have if you've had the flu jab, you have to wait 7 days. And if you're poorly on the day, you may be advised not to have it. So the next slide is about why we actually need vaccines, and vaccinations, they're safe and very effective. We've used them. We've eradicated disease such as smallpox. So this is just another disease we have to get on top of. We know they save about 3 million lives globally per year. And I've mentioned there's a full range of things we already have vaccines for. But one of the things I want to say is being vaccinated is important for a number of different reasons. One, it protects you, and we've discussed that. Also, it does something else. It protects your loved ones, but it also creates something potentially called herd immunity. And herd immunity is if we have enough of the population who get vaccinated, it means that people are less likely to come in contact with somebody who's infected, and therefore it reduces the likelihood of transmission in the population. And that's really important. So you're not only just getting vaccinated for yourself, you're actually getting vaccinated to help the people, in particular those who can't have it for very important reasons. So we're often asked about the safety of the vaccine, and how can something that normally takes 10-15 years be done in a year, and people are concerned. And I can say this slide describes why. Never ever in certainly in any of our lives' time has there been such a global effort with everybody working on exactly the same thing. All the scientists, all the experts have all come together, everybody's working on it, and we've had a limited number money to fund that across globally. We've also, and this is very unusual, we have had numbers and huge numbers of volunteers who are wanting to participate in the trials, because we all know this is really important that we've had to get it. So what this has meant is all of the program has been condensed. So it's not, everything has been gone through and all the stages which are set out here, but they've been condensed. Normally you do one, a gap, then the next, you get the funding, you get the volunteers, and then the next. That's all changed. Even the manufacturing started before we even had a vaccine, and that's just so we can get it out of the door. Ingredients of the vaccine. If you look at a baked beans can, you will see lots of ingredients, and you won't recognize always what those are, because they've got things like stabilizers, preservatives. It's exactly the same with a vaccine. So there are a number of ingredients, stabilizers and other things that allow it to either work better or allow it to be transported better. It doesn't contain any animal products, any egg, or any human cells. There is a trace of alcohol, but if you're happy to eat a banana or a piece of bread, it's no more than what's in those. If you have, initially when Pfizer came out, they said that if you have, that people with allergies perhaps shouldn't have it, because there've been a couple of reported severe allergic reactions. That's changed now. Now we have more safety information. And what it is if you are allergic to any of the ingredients in the vaccine, you will be advised not to have it. That's a discussion that you would need to have. If you had a severe reaction before, you would need to have a discussion with your clinician regarding that. So that's it in terms of my swiftly the science. I'm going to hand you over to Linda now, who's going to talk a little bit through the programme.
Okay, thank you very much, Jackie. And although I'd read the stuff about the science, that really helped explain it a lot better. Thank you. We've had questions about why the priority order. So I just want to run through who's been vaccinated and why, and the programme that we're operating in Greenwich, and how we're getting on with the vaccination programme in Greenwich. So this committee called the Joint Committee on Vaccination and Immunisation has devised the order in which the vaccine should be given. The committee is an established committee of scientists and clinicians who advises the NHS and government on all vaccinations and immunisation. It's been sitting with different people on it, obviously, over many decades, and has advised on polio and diphtheria immunisations and so on. And it's a standard committee that would advise on these matters. And they've been analysing the situation for a long time, and as the vaccine was being prepared, they gave the advice that the order that should be given is the order of people who are most at risk of serious disease or dying if they catch coronavirus. And as we know from all the stories in the press and the statistics, the ones that are the most at risk of dying are the older people and the people in close proximity in residential establishments. And so the order that was decided is the one that you can see on the screen, that the vaccination should start with care home residents and their staff, and people over 80 and their carers, and then work through the age groups. Added into this is clearly NHS staff and care workers, because they are working closely with people all the time and could risk passing it on. So they also have been included in the priority cohorts. But you can see that essentially we're starting with older people and then further down the priority, the age group order. Where we were given a target by the government, which we have met, to have ensured that all people 70 years and over, and also those who are deemed clinically extremely vulnerable, which are the ones that have been advised by their clinicians to shield for all this time, that they should have been contacted and given the offer of a vaccine by last weekend. And we hit that target with room to spare. And I can tell you that at the moment, 80s and over, we have 84% of our population here in Greenwich immunised with the first vaccine. Between 75 and 79, it's 83%. Between 70 and 74, it's 82%. And extremely clinically vulnerable is 72%. And we are contacting them all the time to ensure that we haven't missed anybody, or if they couldn't respond at the time, but they want to have a vaccine. So we're not missing them out. We will continue to contact them to make sure everyone who wants one can get one, and to discuss any concerns or fears that they may have, to make sure that they've got all the information they need to take the decision. And we are now working on people aged 65 and over, and also those who were deemed to be clinically vulnerable, as opposed to clinically extremely vulnerable. So those people with underlying health conditions that put them at higher risk of serious disease. And included in that is carers. So anyone who hasn't already been contacted because they're part of the home care system, but carers of people who are vulnerable are now being asked to come forward and take the vaccine. And Jackie informed me just before we started that 85% of the people we've approached have been we've contacted have said that they want the vaccine, and they're now on a rota to be able to be contacted, to be able to be vaccinated. I'll take the next slide, please, Jackie. So where we're vaccinating in Greenwich, the numbers of sites are increasing all the time. We've had to use static sites that have got the necessary infrastructure for us to be able to give the vaccine, because initially we were only working with the Pfizer one, and that needs very much a tight control over how it's stored and also how it's prepared. It has to be diluted before it can be used. So we've had to get people to go to the vaccination centres and rather than us be able to visit you. But that's improving all the time, particularly as we get more supplies of AstraZeneca vaccine, which can be transported a lot more easily. So what we've done is we started with 3 primary care network sites, which are the groups of GPs. So we have 3 sites covering all the GPs in Greenwich. And those GPs are working out of a centre in Plumstead, one in Eltham, and one in Charlton. And all their patients are being contacted and giving the opportunity to go to those sites for their vaccination. Now, since that was set up just before Christmas, we have had an expansion of the programme, and we now have 2 pharmacies, one in the middle of Woolwich and one in Wellhall in Eltham. And we now have Queen Elizabeth Hospital, all of them issuing vaccination as well. Queen Elizabeth, of course, was doing its own staff and care staff first. And now that's well through their process, if not completed, they can now operate for the public as well. And so there's 2 ways to be able to get a vaccination now. And we'll put something in the chat later so you know how to do this. Firstly, your GP surgery will contact you and invite you to be vaccinated at one of these PCN sites that we've just gone through. Alternatively, you can be contacted directly by the NHS through a letter, and you can also now ring the NHS or email the NHS to make a booking at the pharmacies or Queen Elizabeth Hospital. By the time we get into next month, we will also have a large vaccination centre open at Charlton Athletic, which is likely to be run by GPs. The decision will be taken this week on who will be running that for definite, but that will be a second mass vaccination centre that people will be able to go to. And we've now started operating on being able to do what we call roving models. So now that we've got AstraZeneca, GPs are visiting people who are housebound in their own homes to give them their vaccine. We've had a GP surgery covering all our care homes since December. We have a community bus, which you might have seen the press on, which was launched on Saturday, which is now visiting some of the town centres in order that people can it's nearer to their homes to get the vaccine. And very shortly, we are hoping that we will have other modes of transport which will be a bit smaller, which will be able to go into some of the estates and visit community centres, so that we will be able to contact residents much closer to their homes and through their community organisations. Next slide, please, Jackie. I'm nearly done. Now, we've had quite a few questions about why BAME residents and also other groups of residents are not being in the priority groups. And the reason for that is that most of the BAME residents that we've got who are most vulnerable are covered by those categories that I've gone through, because it's your age and your clinical vulnerability, which in particular makes you particularly vulnerable. So we've worked through those categories now, but also we've had further advice issued by the NHS in the last 2 weeks, which means that we've extended the list of people who could be deemed clinically vulnerable, and they are also now being called up for vaccination. So I've already talked about the housebound, because clearly they're a very vulnerable group we need to get to quickly. And I've already talked about contacting all of the over 70s and over. And I should say that when we're contacting people, if they're not willing to have the vaccine for one reason or another, we are talking to them to consider the questions that they've got and their concerns, to see if we can encourage them to take it. But for those who decline it, we are collecting information for the reasons for their declining, so that we can then analyse all of that and hopefully go back to them later. We are analysing the data that the NHS is supplying in terms of the communities that residents are coming from, including BAME communities and high levels of deprivation, to determine whether or not some communities are more reluctant than others, or we are unable to get to them as easily as others. And we're analysing that data at the moment. And Greenwich, I hope you're aware, has set up a whole project to try to get in touch with communities, and for people that may be missing out on us contacting them through the GP system, to make sure that we're trying to reach out into communities themselves and make contact with people so that they can tell us what the issues are in local faith groups, local community groups, where people may be resistant or not know about the vaccination programme. But we're now working on working with faith leaders as well, to make sure that we're reaching as many parts of the community as possible. And so to wrap up on this, also how you can help us. So firstly, if you have any parts of your community or individuals who are struggling to either understand about the vaccine, are worried about it, or just haven't heard from us, please tell us, and we will make contact with them. Also, if there are leaders in the community, influencers, they might be faith leaders, they might be community organisers of some form, or just spokespeople in local areas or on estates, please contact us so that we can contact them in order that we can try and reach those parts of the community. If you have any information about concerns about the vaccine and how the messaging is received, likewise. Also, there's two Twitter and Facebook links there for information that we put out regularly that we would like you to put things out. We've produced a lot of videos in different languages we'd also like to be put out. And finally, I mentioned community champions previously. If you'd like to register as a community champion, you don't have to do very much, but we will send you information that you can push out to other people so that they can find out more about the vaccination programme. And you can register by going on the Royal Borough of Greenwich's website. So that's the close of the presentation from us both. Thank you.
Thank you very much, Jackie and Linda, and that was very, very informative. I'm now going to go back to some questions that have been put up in the chat before we move on and speak to Saba and Krishna, our local GPs. So I'm just going to open up the chat and go up to the first questions that we had on the presentations. And if I can ask you for fairly quick answers, and again, Saba and Krishna, you might want to come in and support Jackie and Linda on the answers to any of these questions. So the first one is, what's the name of the booster, the second dose of the vaccine? Is this a different vaccine or is it the same? Who would like to answer that? Jackie?
I'm happy to answer that. At the moment, it's advised for you to have the same vaccine as what you had with the first dose. However, part of that is because we don't know whether you can mix and match the doses. There's trials going on currently that will allow us. So I should imagine further down the line that we're able to mix and match. But at the moment, we're recommending same as what you had the first go.
Thank you. Second question, if all the scientists are working together, why are there multiple vaccines and why are different countries using different vaccines? Again, that's probably another one for you, Jackie.
Yeah, so we have lots of pharmaceutical companies, and it was almost a race to the end point. And what they shared is, so from Wuhan, they shared the genetic code, and then everybody went working. So everybody was sharing information, but all the vaccines can work in different ways. So we needed to test lots of different approaches, and all of them are looking like they work in different ways. Some may be suitable for some groups, some may be suitable for not. The Pfizer, for example, is the one that is not transportable very well, because it's got to be it's got to go down to -70 degrees, and therefore that's not ideal when we're transporting it we need to get it deep into communities, or whether we're working with other countries, for example Africa, that wouldn't be a one of ideal use. So it's a range.
Okay, thank you. Can I ask you any other questions? Please put them in the chat box, because I can't catch all hands because we were over three pages. So please put questions in the chat box, please. Just another quick question. This might be for you, Linda. I think you covered it in your presentation, but if you can just briefly answer it again. Why are BAME groups not prioritised, as we know they are most at risk?
Sorry, couldn't unmute then. I have covered it really. I mean, the clinicians have been advising that we will catch almost all of the vulnerable BAME community people, residents, by going through those age categories and the extremely clinically vulnerable groups. But as I said, we've had recent advice regarding extending that clinically vulnerable group, so more people are being invited as we speak from last Monday. Jackie might have a little bit more information on this actually, as to how that decision is taken.
Yeah,
just quickly, Jackie, sorry, I've got a lot of questions to get through.
Very quickly, it was less about a genetic vulnerability, more about the exposure because of workforce or the conditions that they're more likely to have. And that's why if you're focused on the conditions, then by default you are picking, there is a focus on people from BAME communities.
Krishna and Saba, do you want to come in on this one?
Yeah.
Hi, Joy, thank you.
Saba, go on. Yeah.
So in terms of any differences with the vaccine, Marie, there isn't any difference in terms of the vaccine. So as far as I'm aware, if you are trying to conceive, there isn't any risk associated.
And she should speak to her GP as well. She's got any concerns.
Yeah, absolutely, Joy. I was just about to reiterate that. I can fully appreciate there's a lot of information out there and it can be difficult, but your GP will be more than happy to talk through it with you.
I think I would agree with that plan. That's a very sensible plan, because it's contracting COVID and the risk of the complications of COVID outweighs other considerations at the moment. So if I was there, or one of my patients asked me this, I would clearly say COVID vaccine is quite safe. It has not been studied particularly in pregnant women in the studies, but it's the way it works, the mechanism of the mRNA and all that. I can't see it causing lots of effects, but prioritizing the COVID vaccine is important if you are able to plan your pregnancy later. Few months. Probably 3 months or so. That's enough, because it's the vaccine works in the bloodstream to give you immunity from those B cells and T cells. One of those slides which was shown, and it's they will be well established by hopefully 3 months, maybe a month after the second dose. But these are all based on general principles. It's not based on hard evidence. So you could wait for 3 months. You could wait for 6 months. It's basically your decision mainly.
So the vaccine, you're right, it protects you, but it doesn't reduce the risk of transmission. So despite having the vaccine, it's still very important for us to continue with hand washing, wearing face masks, keeping our 2-meter distance.
At the moment, there's no clear guidance on that, but as we heard in the national media in the briefing with the Prime Minister, the scientists and the national medical officers, they are expecting that we might need, that's the trend they are expecting, we might need boosters, because these viruses are prone to mutate over time. So once we get immunity for this, they might try to find a different way to infect, but although in a slightly lesser scale, like the influenza flu virus. So depending upon the strain that is going on, probably next year, scientists will recommend different vaccines. We might need annual boosters, but we don't know 100% at the moment. But that's the trend they are expecting, all the scientists. So it's not 100% that we have to definitely have annual boosters. We need to wait and see how the virus behaves, and it also depends upon the global vaccination in how much we can cover across the world. The quicker and the wider coverage we have for the vaccine across the world, the better for all of us. The thing is, there are lots of diseases, lots of germs, which become endemic, like they are in a very low level in the world. They circulate for decades and decades without causing major problems at all. There might be an occasional outbreak, say, for instance, diphtheria. There was an outbreak, a very rare outbreak in Russia, but it was quickly contained. But most of the world is vaccinated with the diphtheria vaccine. When the baby is born, 8 weeks, 12 weeks, the first vaccinations have that. So it's not going to affect majority of people, but you might get an occasional outbreak which will be contained quickly. That's how these germs behave in the long term when they become very low level endemic in the and they circulate in the world. But these are all predictions. That these are not hard facts. It's based on how the other germs have behaved in the past. Still, we are learning a lot about the coronavirus every day.
We've got a lot of questions, and we're not going to be able to answer them all within this hour. So what I'm going to do now, we've got some specific questions from people with specific conditions. So I'm now going to move to Krishna and Saba to answer some more specific questions. All the questions that you've asked will be answered. We will send round a list of all the questions and a list of all the answers to everyone that's participated in this event, but we've only got an hour, so we just don't have time to go through all the questions today. Krishna and Saba, can I ask you some questions specifically that we've had from the public? So we've had one that says, my wife and I are 67. I am diabetic with 2 heart problems, and my wife has COPD. How much longer do we have to wait?
Thanks, Jerry. So I think that from that information, you'll probably be called up imminently, I'd imagine, because you're in the cohort that's being vaccinated at the moment. So very soon, I'd imagine.
And if people haven't heard in those, those people with those sorts of conditions, should they contact their GP or should they wait to be contacted?
Yeah, I don't anticipate that they'd be contacted by their GP, but yeah, absolutely. If they don't hear from them, there's no harm in contacting your GP.
Okay. And how effective is the vaccine on those who have a long-term health condition?
So the background of condition doesn't affect the effectivity of the vaccine to be as effective for someone with long-term conditions as somebody without it. It's more important for them to get the vaccine because the risks associated with them getting the virus, if that makes sense. Hopefully that makes sense.
Okay, and I've had a couple of questions, and again one in the chat very similar about having an existing health condition and then having to, despite being extremely vulnerable, why do they have to wait so long for the second dose? Can people who are extremely vulnerable not get their second dose faster? And again, Krishna or Saba?
So as one of the slides said, the first dose was very highly effective in those tables of Pfizer, and we saw that in one of those slides. And the idea was to cover as many people and protect as many vulnerable people. quickly so that they don't escalate into severe cases, getting admitted and dying of that. So that was the idea behind if you know, in layman's term, greater good. That's what was driving that. But there is a clear plan. I think during the weekend or in the last few days, in the national broadcast from the 10 Downing Street, they said about a clear plan of how the second doses are going to be given within that time frame, scientifically allowed within that 12 weeks of the first dose. And they've got a clear, robust plan for that to happen, simultaneously covering more people with the first dose as well. And especially with the mass vaccination centers and all, it looks like they've got a clear plan. It was the details we can share, it's as and when it's available. But they've got a clear plan to not miss that 12-week target for the second dose.
Okay. Thank you, Krishna. And just to reiterate again, because more questions in the chat about people who are extremely vulnerable, but there might be in younger cohorts and they haven't been contacted. Should they contact their surgery, or should they just wait to be contacted because they're in a younger age cohort, but they're still clinically vulnerable? Saba?
So the cohort at the moment is 16 above, essentially, with clinical risk factors, so they will be being contacted. So hopefully those who are clinically vulnerable, age shouldn't be a barrier as long as they're above the age of 16.
Right, okay, lovely. And just going back to some earlier questions, and again, this might be one for Jackie and Linda. I've got a question that says, why are the majority of people given the Oxford vaccine when it doesn't work against all the variants? Are you able to answer that, Jackie or Linda?
Yes, well, I can start. So all of the vaccines were developed before we started getting some of those variants, but all of them do work to some extent on the number of the variants. So it is still important to have it. It still has effect. What we're trying to work out is whether that's more of a diminished effect, but it still has effect. So please still have the vaccine.
Okay, and then on a similar vein, if this vaccine is so effective, why do we still have lots of people who have taken the vaccine but they're infected with COVID-19 and hospitalized? Is that the case, Jackie and Linda?
In all of the trials, the people who went through the trials, none of them were hospitalized with severe COVID. There are a number of reasons why that happens. And so if you've had the vaccine, it does take a little while before that immunity builds up. And therefore you can pick up the virus before you've got that immunity. So that causes some of that. And also in some people, especially if you're in some people, it may not work as well as in other people. So there is so some people may react. It's not 100% effective, but I haven't heard that people who are being vaccinated and have built up those immunity are then ending up in hospital. I think it's too early to have that evidence as yet.
Okay, and on a similar vein, will the vaccine be effective for those who have long COVID? And I don't know if this is one for Saba and Krishna. Do we know about the effects of the vaccine on those people that have long COVID?
I'm not aware of any effects on long COVID. What the vaccine does is it protects the individual from getting COVID. So what you would anticipate is that you don't get COVID to then get the symptoms of long COVID in the long term.
Okay. And a question on the local rollout and asking about vaccinations at local surgeries instead of patients having to travel to centres further away. Again, Linda, maybe this is one for you, because obviously we've got the centres, but why can't people have it at their local practice?
I think I tried to cover that in the presentation. It's because, firstly, about the supplies of the vaccine, they're being delivered to specific places that were pre-arranged. And also the vaccine needs to be stored and to be managed. Patients need to be managed in and out so you don't contact each other. But as now that we've got AstraZeneca, as we get more supplies of that, we are planning to be able to take the vaccine out into the community a lot more. The bus is the first example of that. We're hoping that we will get other means that we can do that, and we will therefore be able to bring the vaccine to you more than has happened at the moment.
Thank you. And again, for Sabha and Krishna, what happens if you miss the second dose and you've passed the sort of 12-week deadline?
Sorry, Krishna, go ahead.
No, I'm not sure, Sabha. Why don't you go on? Otherwise, we can.
It's probably more a logistical thing. I was going to ask Jackie actually. If that's
right.
Jackie, yeah.
But clinically, are there any implications for having the first dose and then missing this, not having the second one within the 12 weeks?
Basically, the first dose itself, if you look at the science and how it works, it elicits your antibody producing cells, which are anti-chemicals, which neutralize the particles, the protein spike. And you also have T cells, which have an immunological memory, which will be circulating for months and years. There was a study which said Pfizer vaccine can be effective up to 2 years because of these cells which circulate and things like that. So the first dose itself is going to give you a lot of protection, and some evidence that it gives you some long-term protection as well. So it's not like it's the end of the world. That if you miss, you shouldn't be missing it, and we'll make sure you don't miss it. But if you miss it, it's not the end of the world. But there will be more guidance which will come up for people if they miss it, whether they could have one more booster after 12 weeks. That's better than not having the second booster. So I think that's what will come out very soon, the guidance on that. And anyway, with the change in strains and all that, somebody asked, are we going to get once a year booster of a different vaccine because of the changing nature of the virus and all that? It's how vaccines work is boosters will definitely enhance the immunity, but the first dose is really, really important because that gives you a lot of protection.
Okay.
So it's not end of the world. That's the short answer.
Okay.
Shall I just answer that?
Yeah. Yes, please, Jackie. If you can make it quite quick. Yeah.
All of the vaccines are safe and effective, and you can't compare like with like because the research and the evidence was slightly different. So all of them are effective.
And just to follow on from that, Jackie, is there a choice of vaccines? Can you say you want this one rather than that one, or not?
Currently not.
Right.
Unless you've had a reaction to a vaccine ingredient, and then they may recommend something else.
We have a lot of questions, and I'm sorry we haven't been able to answer all of them within this hour, but I hope that the presentation has been useful. Everyone who's attended this event will get a copy of the presentation and a copy of all the questions and answers. And again, if you have any more questions, do send them in to us at Healthwatch Greenwich. We want to know if you found this event useful, so we will be in touch just to ask you a couple of questions about whether or not you felt that this was a useful event for you, and I think something's popped up on the screen now, just I suppose a very last question, if you can actually go onto your screen and fill in this now. We want to know, do you feel that you now have enough facts to make an informed decision about the COVID-19 vaccine? So be grateful if in the last minute you could fill that in. And just to reiterate, the video will be on our YouTube channel, so you can listen to it or watch the presentation again at your leisure. Essentially, thank you all for coming. Thank you to our speakers, to Linda, to Jackie, to Saba, and to Krishna. And as I said, you will get answers to all those questions. We'll send them out to everyone, and we'll put that on our website as well. But please do take a minute just to fill in the anonymous event feedback. On the basis of that, if people want more information, we could run another session. But if people feel they've got enough information, then hopefully this one session was enough.
Joy, can I ask members of the public and everyone to share those YouTube videos and the answers and all that, because it's not everybody can make these events, and if each of us share it with 2 or 3 other people, it's in the community we know, we reach more people.
That's a good idea. That's a really good idea, Krishna. And again, if anyone is a member of any particular community groups and they'd like a session like this just for their community group, we're more than happy to facilitate that. You don't have to have hundreds of people. You know, it could just literally be half a dozen of you. We're more than happy to come along and do a session like this, you know, with a group of you. So do just let us know. It's 1 minute past 12, so I'll let everybody go and get some lunch. And thank you all for your time. And thank you very much to our interpreters, because we've been speaking very, very quickly. So our apologies. Thank you very much. Goodbye.